Thank you. So actually, I think this is my privilege to share the views that I have about digital age. I have been working on nursing, technology, older people's care for many, many years. And over all these years, I do have some thoughts about what is happening, and I keep on hearing different things, and all these kind of inputs to me make me think about that what are we doing right now? Are these something that nurses should do better? And how could we improve our nursing care with all this kind of technology? You can find that the title is very interesting. It's about Pride and Prejudice. If you were as old as I am, actually, you will remember there's a book called Pride and Prejudice, which is a classical storybook that we always read it when we were young. But I still remember this book all these years, and I keep on put this Pride and Prejudice into my practice as well. So that's why the topic today, actually, I connect these terms and these concepts while I'm trying to argue against what I'm doing and try to tell you what I think. So first of all, I would like to talk about the new landscape of care, of course, and then why we need to use technology in these days and in this digital age, and how do we react as a nurse, and do we think that we are very proud of ourselves, and what kind of proud do we have? And we also use technology all the time. So with all this technology, would that actually expose ourselves to some sort of prejudice, and it may even amplify our prejudice as well. So with that, I try to argue, is it worth to continue to do that? And is that really interesting to continue to use different type of technology to support the humanity side that we always treasure? And would we provide a better care and cure to our patients? And of course, lastly, I would like to propose some actions for us as nurses, how to proceed and continue our care to the patients. You know, when we have the technology, we always get excited, and we know that our patients are with us. And we even introduce the technology to the patients and ask them to use it. So for the older adult, of course, they are in the same pace with us, particularly when we have the COVID time. More older people are able to use the technology, the mobile phone, to communicate with their family members as well as the healthcare professionals. So you can see that older people are trying to keep pace with us using the technology to take care of themselves. But sometimes in some occasions, older people may always say, why not you come over to see me rather than asking me to make a phone call to you or using the Zoom to talk to you? So it comes up with all these comments from our clients. With that, do you think that they are fear of the technology, or would you think that they are actually have some sort of resistance to the technology? So who are actually creating these kind of phenomenons? Are we nurses doing all this? We ask the clients, the older peoples, to use the technology that we provide. So technology in elderly care is not just a myth, it's a reality. It's something that we use it day to day. So when you study your chemistry lessons when you were young, I do think that you remember when we do the lab, we have a test paper. That test paper is called the litmus paper, right? That litmus paper actually is to check out how much acidity of a liquid is. And that litmus paper actually is to distinguish whether this is acidic or it is an alkaline. So to us, technology is the same kind of litmus paper. It's actually checking out how do we position ourselves, that we are very proud of our clinical judgment, our traditional way to do things, and we also check out how much prejudice that we may have towards the patient's capacity to use the technology as well. So technology is not just a technology, it's a litmus test. To harness the technology to make it more effective, of course, we would wonder whether we can use the technology more often. But then the second question comes, do you think that this kind of technology basically is a bridge or it is a barrier to our care? I put robots at home to older people's home, and I hope that the robots can actually help out the uh, older people to improve their life and improve their quality of life. So we put the robot at home and actually assuming that older people would use the technology. On the right-hand side, you can see my PhD students actually try to help out the older people to use the technology at home. So with that, this comes to the digital age. Everyone is talking about technology. Everyone is talking about how we improve our life with the technology. And AI seems to be something that is happening every day to us. So nurses are very proud to say that, yes, we are capable to use all sorts of technology. But at the same time, we are also proud of ourselves to provide the art of care to our patients. Don't forget that nursing is both a science and an art. We are very proud to touch our patients. We are very proud to use the true care that we have human-to-human communications with our patients every day at any time and any place. We consider technology can be just like a cold machine. It can be somewhat without emotion, but at the same time just provide some kind of function to our patients, like this one, this humidifier, actually for those patients who are on oxygen. It is keeping its function, providing humidity to the air when the patients breathe in. But this kind of humidity is not as good as the care that the actual care that nurses provide. Sometimes we ask to use technology to have a continuous monitoring to our patients. We put patients on different types of monitoring system, like measuring their blood pulse, their blood pressure, their blood glucose. But somehow the sensors tell us the figures, give us the figures, and tell us that the patient is all right. But our intuition actually says something wrong, saying that the patients may have something wrong here. So this kind of intuition may be contradicting to the figures provided by the technology, the continuous monitoring system. Same here. We put all the people into a room and we put up all those cameras, all those sensors, assuming that all those sensors can actually provide the best care to the patients. And we are monitoring the patients all the time and preventing them from falls. We want to show that actually the technology is helping us. But somehow this technology may give us an alarm. If the alarm keeps on putting on, the signal keeps on continuously alarming us that the patients are at risk, then we incline to neglect this kind of alarm and assuming that this kind of alarm is a false alarm. It will keep on saying that, oh, forget about those alarms. This alarm is a false alarm. We don't need to care about that. So what happened? If we neglect this kind of alarm, actually we miss out the chance to take care of the patients and prevent the incidents. So our intuition actually is something that we treasure. We know that we have observational skills that actually lead us somehow to forget about those data given by the remote monitoring system. We are very proud of our intuition and our observational skills. So this somehow can be contradicting to those data provided by the technology. Here, we use medication list on the left-hand side, which is a traditional way to monitor the medication administration, right? And we use it for ages. Nowadays, we have some medication monitoring system. The system will be scheduled, and the lock would be turned on once the schedule comes up, and then the patient should be reminded to take the drugs. Okay, so we have this kind of technology to supplement, to support our care to the patients in medication administration. But somehow we are very proud that actually we monitor the patient's conditions from time to time. If we deliver the medications to the patients, actually we would ask whether they really need the drugs or not before we administer the drugs to the patients, rather than just like the medication reminder system, just keep on asking the patients to take the drugs as scheduled. So you can see we can provide more flexible care plan rather than using the technology to give us the inflexible care plan. Nowadays, we talk about a lot of data being provided in the electronic patient system. We may like to share all this data across the disciplines, but in some occasions, we are resistant to this kind of sharing, this kind of data sharing, because we think that this kind of data sharing actually challenges our autonomy. Every disciplines like to possess our own autonomy, and we might not like to share some of the ideas that we have, and we try to keep it to our own professionals. But somehow, with all this sharing system of the patient's record, actually it forces us to be more transparent in some way. And then we have to work with the other team members. The team members do not just limit to other professionals, but actually it includes the patients and the family members as well. In the past, actually, we believe that nurses are the good source of information or the sole source of information to the patients because we are very knowledgeable, and then we can give information to our patients. But when we provide a system, we help out the patients to navigate in the system as well. So we are very proud that we are actually the system navigator. We help the patients to navigate in different types of system. But as the technology becomes more user-friendly, actually the patients are empowered to use the technology directly and get the information without asking nurses. So this may come up with some kind of uncomfortable to us, to nurses. We feel that we are no longer be needed by the patients. So just now I mentioned about all the pride that we actually possess. We are very proud of ourselves to be the information providers. We are proud of the knowledge that we possess. But this is actually challenges by the technologies being provided nowadays. Don't forget that other than the pride that is being challenged, there we have some sorts of prejudice as well. We are exposed to this kind of prejudice in day-to-day activities. Just take this robot at home projects again. We believe that the patients, this patient is a bit in advanced age. She is a bit old. We may forget that this is a patient who has all sorts of autonomy, but we may query whether she is able to use the technology or not. We may have some sort of prejudice on her and wonder whether she is capable to learn about the new technology. So actually, we are creating the digital divide bias in this situation. When we look at the older people who keep on smiling when they use the technology, we assume that they are tech savvy. So that's why we are very much relaxed and believe that we don't need to explain too much to them because they are tech savvy. They're happy to use the technology. Nurses do not need to do much. But while at the back, you can see somebody who is not interested in technology, sitting apart from the technology, and this person may not be smart enough to learn about technology. Then, in some situation like this, nurses may just simply give up to introduce the technology to these patients. So this is called the Wickham effect in the Pride and Prejudice book. Wickham is a very handsome gentleman. He looks very good in appearance. So everyone's like him because he is good looking and assuming that this is a good person. But as a matter of fact, he is not. He is a very cunning person. Actually, at the end of the story, he is the one who hurt somebody. So this Wickham effect is actually talking about that when we look at the appearance, we may have a lot of assumption, and this kind of assumption is the prejudice that we actually have. Like nowadays, we have telenursing. We try to introduce telenursing to many patients. But in some occasions, when we face the older people, we have some prejudice here. We assume that the technology, the video consultation system is too complicated to the older people, and we don't even mention this service to them. This is the prejudice to them. Here, we ask patients to keep record, their daily monitoring record by themselves, marking down their blood pressure, their blood glucose, and pulse in a good notes, okay? When they give the notes to us, would you, as a nurse, consider and wonder whether the records here are correct or not? Would you consider the records given by the patients may go wrong and you don't believe on that? But this is not the things that we should do it. Actually, we put up some sort of prejudice again towards the data provided by the patients. Instead, I think we should use this data as a starter to kick off our conversations to the patients. But in many occasions, we do not actually use it as a starter. We just neglect about the data provided by the patients. Another bias that we may have is about the economy side. We assume that using technology is privileged to those people who can afford to use it. They have to afford to pay for the Wi-Fi, the device that they use. So we assume that those people who cannot afford to pay should not be given the technology, and they are not given technology as a way to support their care, as a kind of option to them. So other than the prejudice we have on the patients, interestingly, we also have the prejudice across professionals as well. We keep on hearing some of the sayings like that. Oh, the engineers do not know the patients. The computer science experts, actually, they do not know anything, but they just know about the figures. They do not know how to interpret the figures. And those website builders, they actually do not really understand the real patient's care. So we consider these people are they are not we. We are not in the same boats. Considering those technical people, they are very different from nurses. Again, we put up this kind of prejudice on people, on other professionals. Like this one, I developed a system, which is a gamified system for the staff who work in the residential care home to learn about infection control guidelines so they can play the game. You can see on the right-hand side, the games is that they can use a mobile phone to use their fingers to drag on the screen so as to choose the PPE that is suitable for some scenario. Okay, basically this kind of gamified training is very good for the staff. But somehow we may have some prejudice on those staff and considering them they are not very capable to use the technology and assuming that they may have resistance to use these kinds of useful tool as well. So again, this is a prejudice that we have on the staff capacity to use technology. So we talk about the pride that we have, the nurses have, the prejudice that we may have on the patients, as well as our cross-discipline collaboration. Now let's talk about the cost. How much cost would we have to bear if we really use the technology in our care? If we use technology in our care, would we provide a better care or a better cure to the patients? Would we be able to foster tech-enabled humanity? I just wonder. If we have all those prides and prejudices, I am sure that we have these sorts of consequences. What are the consequences here? Is that actually we are widening the care gap. When we talk about widening the care gap, we are actually talking about that those people who may or may not be able to use the technology, we have the assumption that those people who are frail, who are isolated, older people, they are not eligible, they are not entitled to use technology. So that's why we don't give the technology to them. So actually, we are creating the care gap here. In some occasions, we actually put ourselves into a situation that our burden would increase. We actually assuming that some of the technology, initially, it can be automated. And like the one that I mentioned about the medication reminder system, it is an automated system. But if we don't believe that kind of system can actually help us, we forget about the system. We still keep on using our pen and paper. We want to keep a good record on that. And we just believe that we are the best person to keep the best record. So we are increasing our burden to ourselves. So that's why there would be an increased clinical burden. And that may lead us to go for burnout eventually, because we have more patients and we have limited manpower. We are not able to carry out all these kind of incidents. Another consequence that may be possible is that we may miss out the opportunities to provide the best care and even protect our patients and provide the best safety situations to our patients. So just now I mentioned about the continuous monitoring system. We have the sensors monitoring and prevent the patients from falling. And we do not believe that that kind of alarm is a true alarm. We assume that that is a false alarm. Actually, we miss out this alarm and ignore these alerts. And we eventually miss out the opportunities to provide the safety environment to our patients. The last possible consequence, if we have all this pride and prejudice, I'm sure that actually we are infantizing our older people. What does that mean? It means that we would assume older people are not eligible and they are not the best citizens to use technology. We just get hold of the technology and not allowing our older people to use the technology. And actually, we are robbing their autonomy to take care of themselves. Just like the one that I mentioned, we keep on using our own blood pressure monitoring when our older people are in the clinics and neglecting the continuous monitoring system that they have at home, even though they show the list of blood pressure, blood glucose record to us, we neglect about them. We actually give up the chance for them to take up the active role of care by themselves. So we are actually infantizing our older people. So this is the extras that we have done. We may have done all this. If we have a prejudice, if we have all these kind of prejudice, we assume that no technology can actually help us to do anything. This is not something that we really want to see. With all the technology in these days, we have no way to escape the use of technology. This is the tech world. This is a tech age. And nurses are actually one of the good participants and users of all this technology. So that's why I think we should work out some strategies to use the technology. And how to use it? Maybe I can propose some ideas here. Like we have to adopt a co-design way to work with the patients. The patients are the partners of us, and we are designing the system together. It is not the professionals who know the best and design everything, design all the technology, and just let the patients to use it when the technology is ready. That may not be the best solution to our care. But on the contrary, if we involve the patients in the co-design approach, we figure out what is the best way to work out all the features and how to format the features and show it into the platform that is elderly friendly, user friendly, then that could be some technology would be welcomed by our clients. And from time to time, we may need to conduct health technology assessment. What does that mean? The health technology is something we start with a technology, but the ideas of having this technology would not be successful if we do not have sufficient knowledge about the clinical needs of the patients. And if we forget about the patient's affordability, the financial capacity, whatever design, whatever technology we provide to them, if they cannot afford that, then no one can use it. So in the whole process of health technology assessment, it is very crucial to consider the financial capacity of the clients. And of course, we would need to keep the regulations in place as well. That means that whenever technology we develop, we actually need to be following the regulations that we may have in our own community. And of course, we keep hold of the professional standard that we all have. So for the health technology assessment, it's an ongoing process that help not only the patients to make decisions, but they are making decisions together with us. They can use the technology because they are able to afford to use the technology. And they are happy to receive the outcomes from the technology. And at the same time, of course, the services being delivered through the technology will not be just do it because the professionals believe that they need it, but basically it's the patients also agree that this is the services that they need. We should champion digital literacy, not only for the patients, but also for the nurses. What do we mean by digital literacy? That means that we are capable to search our information, new knowledge through the internet. This is the digital world. We need to learn about how to search the new skills, the best knowledge that we have in the internet. The digital search skills is very important. But at the same time, we also need to manage our identity in the online system. Every one of us are using social media, right? But at the same time, don't forget, social media is one of the most active platforms that our patients get information from. So that's why if we are professionals, we have to keep our identity very clear in the online platform to ensure that the patients are getting the best information from the trustworthy identity. Of course, we need to know about how to critically evaluate the information that we collect from the internet. We have to build up our own critical thinking, and we have to ensure that it's not everything that is on the internet is trustworthy. We have to critically evaluate who is providing that source and whether those information is updated. And of course, the internet safety is important, and we have to ensure that we do not just copy the internet information and then just put it up as the information we provide to the patients. AI is something that we always use when we prepare our materials. We have to ensure that we use the AI in a smart way. We are using the technology to support our professional knowledge. At the same time, we are not just solely rely on the information provided by the AI. Sometimes those information can be incorrect. So lastly, I think that we need to reflect on our practices. The practices that we did, we may need to ask, when did I last dismiss a piece of technology or a patient's ability to use it? If I just dismiss the technology, that means that I do not use that technology anymore. Is that the problems of the technology, or is that the prejudice that I have on the technology, that I don't believe that the technology can help me? Would those patients who are quite capable in some way to use the technology, but I just have too much pride on myself, and I believe that I am the best person to help the patients, and I don't believe that the patients has the ability to make decisions to get the things right, and I just neglect about the ability to use technology, and I don't even bother to introduce the new technology to them. So all this can actually happen, so we have to keep on reflecting whether we did all this. And of course, we may also need to reflect on whether we have any kind of bias behind when we have any conversation with the patients. So as a conclusion, I would say technology doesn't replace the art of our nursing field. It reframes us. It reframes the whole nursing discipline. Our role has been evolving. We are not just the sole holders of the knowledge, but we are actually a good interpreter of all this knowledge in this digital world. We are the coach to our patients, and we are the human connectors, connecting our patients to the digital world. And this world is not just one discipline, it's a multidisciplinary world. And I would say this is an ecosystem. And this kind of ecosystem is tech-enabled care ecosystem that we are in. So I like to call for some actions when you hear all this. The actions, of course, we should be continuously be proud of ourselves, ensure that we are very adaptive to the technology. We do not have too much resistance to the change, to use the technology. As a nurse, we are very proud to adopt the technology in these days. But at the same time, we do not put prejudice on our patients. We would not just say our patients can't use technology, but actually we are curious to say that what can we do to support them, to work with the patients, to work together with the patients and get the right tools for them to use it. So these are something that we nurses should do. The goal, of course, is to make the patients continuously using the technology and they don't have any resistance to be monitored by the technology. And at the same time, they are supported by us, by nurses. And we know the best about the technology, what kind of technologies actually can deliver the best care to them. We are providing high-tech care, but at the same time, we are delivering the deep, high touch, the human touch to our patients. So that's what I have prepared. But before I go, I like to have some marketing side is that just want to let you know that we have a WHO collaboration centers in PolyU that we focus on community health services, and We are designated by WHO. Since 2019, we are designated to focus on healthy aging. So we work very closely with the WHO regional office for the Western Pacific. And we have worked out lots of strategies to support aging in the region. We did a lot of big data analysis together with the WHO, and we have publications analyzing what's happening in the Western Pacific region in old age. And we try to support different countries to build up their capacity to use the WHO ICOP model. And we provide advisory and consultations to all these countries. And we are very happy to support everyone who are interested to work on healthy aging. So we publish together with different countries, including those who are from Singapore. We publish with them. And the paper that we did it in Hong Kong, the first paper that we did it is one of the most cited ICOP papers in the world. We are very proud of what we are doing. So if you are interested in ICOP training, do scan this QR code or goes to the website that we have. Actually, we keep on having different types of courses related to ICOP, and I hope that in the future we could be able to see you in the ICOP training as well. All right, so thank you very much for listening to my presentation, and I hope to receive some of your comments and suggestions as well.